My name is Greer and I'm the project coordinator of the Healthy Beginnings projects. Today I want to give you just a little taste about what Healthy Beginnings is and how we function as a partnership project within Sydney Local Health District. So Healthy Beginnings is a staged early years intervention which is delivered by child and family health nurses with the ultimate goal of preventing the early onset of childhood obesity. Over the past 10 years, Healthy Beginnings has been developed, implemented and evaluated within the Health Promotion Unit of Sydney Local Health District in partnership with Community Health and also Sydney University. Healthy Beginnings was the first home visiting intervention in the world to show a positive reduction in childhood BMI at 2 years of age. And so in 2016, we were awarded a translational research grant to integrate and scale up the successful Healthy Beginnings programs into different services to be a more low-cost and broad-reach program. Healthy Beginnings has attracted a number of high-level research grants, including NHMRC research funding. We've been the recipient of a number of awards, including the New South Wales Health Award for Public Health Innovation Research. And we've also published over 30 peer-reviewed research articles in top-tier journals such as BMJ. Across the world, there's also significant interest in Healthy Beginnings. So outside of Australia, there are a range of regions that are potentially implementing Healthy Beginnings, and that includes the US, the UK, China, and also the European Union. So we have a program that we know can work. It can reduce childhood BMI, but the question now is how can we get that program to the people that really need it? And that's what the new Healthy Beginnings programs are all about. So before I go any further, I just want you all to ask yourselves, do we really need Healthy Beginnings at all? Why do we need a targeted program that's specifically targeting childhood obesity? And unfortunately, the answer is yes to both of those questions. Because in Australia, 1 in 5 children aged just 2 to 3 years old will be overweight or obese. And that figure has doubled in the last 2 decades. That's really important because we know that being overweight as a child is associated with some negative health outcomes across the life course. So it's really important that we intervene early. The research tells us that some of the most modifiable factors that contribute to the early onset of childhood obesity include things like infant feeding practices, such as the duration of breastfeeding, the timing of introduction of solid foods, children's eating habits, and also their exposure to screen time. And those are the sorts of themes that our Healthy Beginnings program is structured around. Importantly, Healthy Beginnings also addresses the New South Wales Premier's priority for reducing childhood overweight and obesity. It addresses the World Health Organisation's Ending Childhood Obesity Commission report, and it also addresses a number of Sydney Local Health District key performance indicators. So it's definitely a warranted program. But Healthy Beginnings today looks quite a bit different than it did when it started 10 years ago. Now it's actually a suite of programs which are designed to address the varying needs of parents and families in New South Wales. What I want to talk about in a little bit more detail today is the largest aspect of our Healthy Beginnings suite, and that's the Communicating Healthy Beginnings Advice by Telephone or CHAT study. So the CHAT study is a translational research grant funded project which is designed to determine the effectiveness of implementing the successful Healthy Beginnings program using telephone and SMS support. The CHAT study is a partnership project with 4 local health districts. So Sydney Local Health District is the host organisation, and we also partner with Southeastern Sydney Local Health District, Southwestern and Southern New South Wales Local Health Districts. In February of this year, we began recruitment to our study at 8 public hospitals across those 4 local health districts. And in the 5 months to July of this year, we recruited 1,155 women to our study, which now makes it the largest randomised controlled trial in the world to address early childhood obesity prevention. in the chat study, we've delivered more than 2,500 Healthy Beginnings intervention booklets, which are pictured here, and they're actually developed in-house by our research team and our child and family health nurses. We've delivered more than 9,000 SMS messages to our participants, and we've also completed almost 800 telephone support calls. So one of our SMS recipients provided us with some feedback, saying, "Wow, that's really nice of you. I'm really touched by your kindness." Another SMS recipient simply says, "I love my morning breastfeeding messages." One mother we spoke to, who was a mother of 5 children, said, "Thank you for all of your information. So many people tell you what to do, and it's good knowing the right way, especially for my 18-month-old daughter as well." And lastly, one mother we spoke to, who actually spoke English as a second language, said to us, "Thank you for speaking slowly and giving me time to understand and ask questions." So we've had some really positive feedback on our program so far. So I just quickly want to tell you about 2 new innovations that we're developing as a part of the Healthy Beginnings suite. The first of which is the development and expansion of our Healthy Beginnings app, and the second is a feasibility study to address the needs of our culturally and linguistically diverse families. So this is an example of our current Healthy Beginnings app, which was funded by the Sydney Local Health District Pitch program. It's been so fantastic in delivering our Healthy Beginnings messages to families that we're now looking at the feasibility of expanding this app to encompass the first 500 days of life. So that's the beginning of pregnancy through to the child's first birthday. And we're looking at partnering with the Office of Preventive Health, who host the Get Healthy in Pregnancy program, to expand this app. And so that's another example of a partnership project that we're working on with Healthy Beginnings. Lastly, I'd like to tell you about a really exciting new project that has actually arisen out of the chat study data. So we've learned that 2/3 of our mothers were born outside of Australia, and more than half speak a language other than English at home, and this is actually not dissimilar to the census data in our area. Therefore, we've identified a clear need for a culturally appropriate and translated service for these mothers. And we are currently in the project planning and recruitment phases of this feasibility study, which we will initially target at Arabic and Chinese communities, with a view to developing our program to further languages and cultures should this prove effective. I had a last slide, but I would just encourage you to head to our Healthy Beginnings website if you'd like more information. You can actually download all of our booklets for free and use them if you choose to. And on behalf of all of the project team, many of whom are pictured here, I'd just like to thank our partners, in particular our local health district partners, community health, our funding bodies, and most importantly, the parents and the families who participate in our programs.